No confirmation from health officials just yet on whether the Delta variant of COVID-19 has landed on Bahamian shores, with an increasing number of Bahamians getting sicker from the virus, and this evident by the recent upswing in hospitalizations. Local health expert Dr. Nakia Forbes is lauding the potential for more Bahamians to be vaccinated with the pending arrival of the Pfizer vaccine. She spoke with our Cleopatra Murphy.
As the rate of hospitalizations from COVID-19 in the country continues to climb, Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, says Bahamians should be on high alert as the Delta variant is 60% more infectious than the Alpha variant that had dominated the UK. People are much more likely to require hospitalization, a reason she insists vaccination is a vital tool, despite a reduction in effectiveness against the Delta strain.
Overall, the AstraZeneca vaccine, the effectiveness is about 60% against this variant. But it is still very effective in people who are fully vaccinated, including with AstraZeneca, to reduce hospitalizations and deaths from this variant. But we do have to be concerned about the Delta variant. And there will be other variants COVID that emerge as long as outbreaks are continuing.
Up to Tuesday, 67 people were hospitalized in the Bahamas. CNN reports that an analysis by Israel's government suggested that Pfizer was shown to be 64% effective against the Delta variant, where it had previously been 95% effective against other variants, but still 93% effective in preventing severe illness. In comparison, preliminary results of a study in Scotland showed Pfizer to be 79% effective against the Delta strain and AstraZeneca 60% effective. A Public Health England study, however, showed that Pfizer continued to be 96% effective against hospitalization and AstraZeneca 92% effective against the spreading variant. With the Bahamas soon to receive 57,330 Pfizer doses through COVAX, Forbes says having access to multiple vaccines is a positive.
There are certain things, different characteristics about how these vaccines work. Some things are a little different, and there are some side effects that have been reported that may help to recommend vaccines for certain populations. But all in all, it's a good thing to have more than one vaccine and multiple vaccines available. So that's great. I look forward to having other vaccines.
As the Bahamas continues to battle the third wave of COVID-19, with 264 lives lost to the virus since the start of the pandemic, Dr. Forbes says it will be important to maintain public health measures through a multi-pronged approach. While the U.S. has lifted its mask mandate for fully vaccinated people, she points out that both countries face different realities when it comes to vaccination rates, and the Bahamas must do what is necessary to keep cases manageable.
When you have a population that's largely unvaccinated, well, we know that COVID-19 can still be transmitted, and these newer variants may break through the vaccines. And there can be such a thing as breakthrough infections. And so it is wise at this time to have a robust vaccination program with an aim toward high accessibility and large numbers of persons vaccinated and good following of the public health precautions.
Minister of Health, the Honorable Renward Wells, estimates that just 1/8 of the country's population has been vaccinated against the potentially deadly virus. Cleopatra Murphy, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.